hi. Startled me a little bit there. I'm just sitting out here right now by the fire, getting ready for the next show, and it's going to be a good one. You know, I was thinking, since we're both waiting for the show, why don't you hop on over to hartson.org. Check out the website. You can find links to listen to just the audio show by itself. Maybe you're on a drive, or maybe you're just sitting in bed and want to watch one of the old episodes. We've got that there. And don't forget to scroll down to the bottom where you can get your merchandise. Like this hat right here. This is fresh off the press. And this is the Bryan Hartson Show 2021 hat. I'm really proud of it. And I think you'll be proud to be able to walk around and talk to people about all the issues that are going on in the world that you're in the know about because of the show. Well, I'll be seeing you in a few minutes. Thanks for stopping by. It's going to be a good show. Hi, I'm Bryan Hartson, and this is the Bryan Hartson Show, Hartson USA. Today, we're going to tackle the important subject of the coronavirus, the vaccine, and should you get it or should you not? You decide, but we'll give you the facts. You'll want to stay for the entire show because at the end, I'm going to give you some mind-blowing statistics, and you decide. Let's see what we've got going on. Come on. And welcome to the Bryan Hartson Show, Hartson USA. Today we're going to talk about the coronavirus and vaccines. Should you get it? Should you not? We have several clips that you will want to watch. And at the end of the show, you're going to want to stay for some staggering information that's statistically correct and accurate. Do you know what a jab is? Or do you know of any side effects from getting a jab? Those questions and so many more will be answered as we go through the broadcast today. First, Hannity had on his show a nurse that was terminated because she refused to take the vaccine. Mind you, she also was positive for COVID and overcame it. Let's take a look at that clip right now.
We are learning tonight that a total of 153 workers at Houston Methodist Hospital have either resigned or have been fired because they refused to get vaccinated, citing the fact that the vaccine is only authorized for emergency use. Now, the workers filed a lawsuit this spring. It was dismissed by a federal judge. In my opinion, that should never have been dismissed. The group is rightly appealing this decision. Joining us now with What's Next, Jennifer Bridges. She was fired. She was terminated from the hospital. Her attorney is with us as well, Jared Woodville. I want to, first of all, thank you for being with us. We really appreciate you being here.
Thank
Jennifer,
you.
I'm sorry that you got fired. Now, I want our audience to know I wouldn't ask this question if I didn't have your permission to ask it ahead of time. You had COVID, I understand. You have antibodies.
Yes.
Now, correct me if I'm wrong, we've been lectured again and again to follow the science, right? The Cleveland Clinic said if you have COVID, you don't need a vaccine. That just came out in the last week and a half. That's number one. Number two, if people are vaccinated, I thought they're supposed to be protected. So in other words, they made their decision. So it should make no difference what your decision is, should it?
No, I completely agree with you. If they took that vaccine and they feel safe about it, then they shouldn't worry about if we had it or not. And the Cleveland Clinic did a great research article, and I had COVID last summer. I do not need that vaccine, and Methodist did not care about that. That was not an option at all.
Yeah, Mr. Woodville, I'm a little surprised that they threw this out of court because this, to me, is a basic, right to medical privacy case. This is about individual choice in life. Everyone else, we're told if you get the vaccine, you're protected. So they have, every other person, they have their responsibility to make their own decision, right?
You're absolutely right, Sean. For the first time in the history of our country, we have an employer saying to their employees, as a condition of employment, you have to participate in a vaccine trial. You have to take an experimental vaccine. We think this is completely inconsistent with the law, both federal statutes and the Code of Federal Regulations. But I think what makes this even more egregious is that folks like Jennifer, the heroes that I represent, they were the individuals on the front line during the height of the pandemic. They were the individuals that we celebrated. And as a result of their service, she contracted COVID-19. She recovered and recuperated, and at the time we said, go, girl, go. But here we are today. Methodist Hospital says, you won't submit to or participate in our vaccine trial. Here's your pink slip, sentencing her to bankruptcy. And that's just plain wrong, and that's why we're standing.
And there you have it, straight from one of the people that had to resign from the hospital. Is it right that they are either going to be fired or have to resign? She, number one, had the virus. She overcame the virus. If we follow the science, she will not get that virus again. Mind you, the vaccine is specific and not general. Like the flu shot, when you get your vaccine, it's for the COVID virus strain that's out there right now. All right, that's important. The other thing that's important is when we're talking about taking the vaccine, this is still a trial. This is still in the developmental phases. We're going to talk a lot more about that in a little bit, but what I'm hearing now, and this is what I'm hearing, is that if you are taking the vaccine, you have to take the vaccine for 10 years. And I just heard that this week for the first time. Doesn't surprise me, but it also doesn't answer the question with the different strains that are coming out right now. And now we have a new strain apparently that is coming out. If you've had the vaccine, are you immune from the new strain? I don't know what the answer to that is. The experts are supposed to have that answer. What I do know is there's a lot of questions about whether I should take the vaccine or you should take the vaccine. So right after the break here, we're going to listen to a spot from Tucker Carlson, which is pretty enlightening as well. Stay with me.
Hi, this is Philip with Trinity Teas, and we're at the Old Town Temecula Farmers Market in Temecula, California, Saturdays 8 to 12:30 p.m. And we're talking about our teas. And the Golden Milk is all anti-inflammatory. It's ginger, turmeric, and cinnamon, sampled in a vanilla almond milk. Extremely anti-inflammatory. We sample it in the vanilla almond milk, no dairy, no caffeine, and we make it taste like a Mexican drink called horchata. If you haven't tried that before, it reminds people of like a cinnamon toast cereal or a nice dessert drink. So come and check us out at the Farmers Market in Old Town Temecula, Saturdays 8 to 12:30. Have a good day.
Dr. Jill went to Nashville on Tuesday. She told the locals that she was gravely disappointed in them because because they weren't taking the coronavirus vaccine at the rate she wants them to, and they didn't appreciate it.
This state still has a little bit of way to go. Only 3 in 10 Tennesseans are vaccinated. And, well, you're booing yourselves.
You're only booing yourself, says Dr. Jill. Real doctors, though, are starting to have some concerns about these vaccines. The CDC has just acknowledged that the vaccine is linked to higher rates of myocarditis. That's a potentially fatal heart inflammation. The World Health Organization says that young people should not take these vaccines. Last night we spoke to one of the men who invented the mRNA vaccine technology about his concerns.
My concerns are that the government is not being transparent with us about what those risks are. And so I'm of the opinion that people have the right to decide whether to accept vaccine or not, especially since these are experimental vaccines. This is a fundamental right having to do with clinical research ethics. And so my concern is that I know that there are risks, but we don't have access to the data. Certainly, I can say that the risk-benefit ratio for those 18 and below doesn't justify vaccines, and there's a pretty good chance that it doesn't justify vaccination in these very young adults.
And I think it's important that you hear what the gentleman just said. It's basically dangerous for our children to be taking this vaccine, and it's experimental. So let's dig in a little bit more. People have had the vaccine, and people have had reactions to the vaccine, and that's really what this show about is tonight, to talk about whether or not the vaccine, the risks to the vaccine are worth taking the vaccine. Now, what's going around heavy on the internet right now is very simply the thing called jab. Now, a jab is actually getting the injection, and so that's, you'll hear that a lot. Jab means, did you get the jab? Did you get the jab, man? Not basketball. Did you get the injection? As a result, some of the side effects of the jab are that it's contagious. Did you know that? That blew me away. Now, here's something that's really interesting about the fact that they're saying that it's contagious. And that is, you don't have to be in direct contact with somebody that's had the vaccine in order for it to shed. And that's another key word right there, shed. You can shed the vaccine to somebody that's in the proximity of you, much like when you sneezed, and they talked about how far that sneeze can go. Well, the shedding can actually go, and it can get onto another person's skin. So if you're getting your nails done, or if you're getting your hair cut, maybe you're at the doctor's office and you're sitting next to somebody that's relatively close to you, even though you have the 6-foot difference thing and all that sort of stuff. Or now with the grocery stores opening up, you're not wearing a mask in a grocery store any longer. The distance is getting smaller. And I'm not trying to freak people out and go the opposite direction and say, okay, now you have to, not only when you're vaccinated, you have to wear a mask, but you've got to be aware of some of the serious things that are being said about the virus. And Pfizer is even coming out with some of these reports that are talking about this virus and this shedding, and it's important. Here's another thing that's important. When I went through and looked at a lot of the data, I went case by case because I wanted to make sure I was giving you some accurate information. Now, the reporting that I looked at is pretty accurate. It's from an actual database, and it's from the VAERS database. And thank you, Stacy, for helping me out with the research on this. It's reporting symptoms that patients have had that have had the vaccine. So right up front, full disclosure, some of the information is going to be double tabulated because the person came in for one thing, one symptom, and later came in for another symptom, but they only got the vaccine the 2 times or the 1 time. So with that caveat there, we've got enough data, though, to say there's some things to be concerned about. And we're going to be listening to Amber Nicole Miller on her Instagram. And I actually had a chance from Cynthia to listen to quite a bit of Amber's posts and videos that she has up there, and the compliments of Cynthia Ross. Thank you so much for that. I appreciate that. So I did take the time and look through that, and I thought this was pretty important for me to just share with you. And so here it is from Amber Michelle Miller on Instagram. Mind you, this is her opinion, her statistics, but it's also pretty scary. And let's chat on the other side here.
So I want to preface this first by saying that this is my opinion and also things that I've read off of the internet, obviously, and some people have written to me and sent me information about their own stories. I want to speak about what's going on with shedding. This has happened to me now multiple times, and Pfizer has admitted that their mRNA jab also can be spread to people who have not had the jab. They can be environmentally exposed by inhalation or skin contact. This is a real thing. I'm going to show you first the picture of me and the rash that I got. Also, multiple friends and people have written to me and shown me. The friends who've written to me have sent me their story as well as pictures of their rashes also. Not only is this affecting people's skin, but as everyone knows, there was a huge Facebook group, I'm going to pull it up here, that was removed. It had a group of more than 8,000 women talking about having irregular periods, which I also experienced. I sort of didn't take it seriously because I have had issues in the past, but for a group to have more than 8,000 plus people talking about having irregular periods after being around someone who had had the jab, this is really scary, and it's a real thing. And it's happened to me now twice after being out in public, and some of my friends as well. I'll also put that in the slide so that you guys can see that. That group was actually removed from FB. I've got notes on my laptop, so I'm going to look over here real quick. In Economic Times, it said that the COVID-19 scientists plan to develop a self-spreading bug jab. Also, the Express said that the Cure scientists plan a bizarre self-spreading jab and to fight this pandemic. And then in the Bulletin of the Economic Scientists, scientists are working on a jab that spreads like the disease. What could possibly go wrong? All of these articles were from 2020 in September. And then there's another one that says the jab of the future could be as contagious as a virus. That was in Popular Science, and that was also published in, June 2017. I'll put those in the story right now. There are many other scary side effects and accounts of things that are happening to people that are not jabbed and been around other people that are jabbed, women who are pregnant and are experiencing miscarriages as well as having issues during their pregnancy. There was a study actually released by Pfizer, and it said a female was found pregnant while being exposed, having been exposed to the study intervention due to environmental exposure, which means she was around someone and she had a miscarriage. This is an actual study on Pfizer, and I'm going to put that in this slide as well. There's a lot of stuff that they're not telling us, and I think that we should be very aware of that. And I'm wondering if there should be some sort of quarantining of people who do decide to get the jab so that they're not around healthy people and exposing them to these things.
And there you go. Thank you, Amber Nicole Miller, too. Appreciate you putting yourself out there and sharing your thoughts. And those are Amber's thoughts. You don't have to agree with them. You don't have to like them. You just take them for what it's worth. And I'm going to share with you some statistics very shortly that is going to blow your mind. You are going to have to second think everything you have to think about when it comes to COVID, vaccinations, and age. And yes, of course, pre-existing conditions. Going back to what Amber and many other people on Instagram have posted, women are severely affected by their menstrual cycles where they've received the vaccination. We talked about what a jab is. A jab is the injection. Anyone around someone who has had the jab may be getting some symptoms such as Amber shared with you from herself. I've seen several different posts from people with pictures that have been around people that have gotten the vaccination, either manicurists, hairstylists, pedicures, grocery store. It's out there. It's still transmitting. Well, at least it's contagious, all right? The side effects of getting the jab is contagious. Pfizer is well aware of it. They say that shedding is known. It is normal. And mRNA jab will expose those who haven't gotten it to a spike in proteins by inhalation or contact. And it can affect pregnant women. Shedding, can go on for months. So the question is, you got your vaccination. Now do you get quarantined? Well, interestingly enough, Jesse Ventura back in 2009 had a conversation with the Dr. Rema Lalbro, and she stated that the WHO, back in 2009, stated that the WHO believed that we had too many people on the earth, if you will, and that they were working on a permanent sterility process, and it dates back to 1974. Interesting. She also said if you refuse the vaccine, concentration camp. Refuse the vaccine in today's time, you get fired from your job, even if you've already had COVID, even if it was a long time ago, even if you have the antibodies. Interestingly enough, it's now come out that if you've got the vaccination, you need to get another vaccination every year for the next 10 years. It doesn't necessarily say whether or not it will take care of the strain changes as they go along, just that you need to get one every 10 years, or every year for 10 years. I'm concerned. So women in bleeding and muscle problems and heart problems and age. Let's move into the last phase of this conversation. The phase that I have spent a lot of time digging into and looking at. I went to a database and looked at the VAERS database, which is a database, and I'm going to disclose it right now, that the database is comprised of everybody that's gotten vaccines that they've been able to track. The data that I'm going to share with you tonight is good through June 11th of this year. Interesting thing is, I want you to be aware of, you get a vaccination and you have no symptoms, you don't go in the database. You get the vaccination, you get a symptom, you go in the database. And your symptom is severe or not severe. That's 1-to-1, right? Now, you get your vaccination, you get a symptom. Months later, you get another symptom. It goes in the database as a number 2. So 1 vaccination, 2 different entries. I want that to be up front with you. This is all experimentary. So, when we're looking at the data, it is not one for one, and it is not that every symptom correlates back to a person that's had the vaccine. It just so happens that person that's had the vaccine has a symptom. The concerning thing that I have around a lot of this information that I've been able to dig through is the fact that a lot of it deals with cardiac issues, muscle issues, fainting, dizziness, blood pressure, pulses being up, passing out, bleeding irregularities. So what I did was I decided to sit down and put together a little random list of different things that I could pull out from this database and share with you that would be in your face. And I promise you, I did not go in and look for specific cases. I looked at randomness, okay? So when I looked at randomness, I decided to take a first slice, and that first slice was to look at graphs and to look at numbers. And so that's what I did. So if we look here, I'm going to be looking back and forth different places as I'm looking at this stuff here, all right? So the first one that we're going to look at today is this one right here, which is 358,379 cases were vaccine targets of COVID-19, specific to COVID-19. If you look at the chart, you're going to see the age and the different issues, outcomes. Not really important for what we're talking right now about, but you can see that age range between the age of 17 to 75 sort of goes into an arrow, and you can see the narrowing down at the 17 to 44 year age range. Okay. Okay. Second part of this is the data numbers, not just the graph. So the numbers tell us that overall 1.5 million people, over 1.5 million instances of people that have gotten a vaccination have been entered into this database. What's really interesting is the age of under 65 is the majority of all of the cases being entered with symptoms of people that have taken the vaccination. We know we were focused on people having vaccinations that were older at first, right? So you would expect that number to be higher of the older people, but that's not the case. Okay, just want to put that out there. The big anomaly, the younger you are, the higher symptom count. It's in the data. Now, do we trust the data? Well, I'm giving you the data. Got to sit around my campfire today and got to wear my nice little Bryan Hartson hat. Now, you can get one of those, hartson.org. I love it. And people can ask you, "What, man, that's a cool symbol. What is that?" And you can open up a great conversation about different subjects such as this one right here and know what you're talking about because we got the numbers. Okay, so getting back into this. There's some reason there's about 2,800 people that have been severe symptoms after getting the vaccination, and we don't know what their age is. Okay, so they go off in this pot over here. Again, this is not going to be perfect data. This is only as good as the people that enter it and the way that it's sliced. I'm slicing it the most honest way I can for you. Again, I want you to be educated when you go to talk to somebody and they say, "Oh, well, blah, 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 blah." You can go, but Bryan Hartson says, and he can support it. Then you send them on over to strim.com and watch the 24/7 feed. And we get another satisfied viewer. So very interestingly here, severity, the count of people that have gotten the vaccine and had a severe reaction increases over time. And I think I pull that slide up for you real quick here. So I got to remember to do this for you here. Let's pull that slide up. Okay, and there we go. So the interesting thing though, we know that 99.9996 whatever percent virtually nobody that's a young person or a child is going to die from COVID. You might get it, might get sick, right? Get a runny nose or what have you, but they're not going to die. Yet we do find that when you get the vaccination and you're under 65 years of age, you're more likely to get a side effect or a symptom. And again, keep your eye on the ball because we're going to be talking about the heart coming up here. All right. Moving on. I'll try to move these up if you can't see them, but I think we're going to be doing okay. Symptoms by age. So out of the 358,379 symptoms from people that had gotten a vaccination, if you look at the yellow line and you look at the blue line, not severe symptoms, yellow line, severe symptoms. So not for count, but just so you can see the variance. There is a big difference, but what is consistent is that age range. And if you look at minor symptoms, 17 to 65, 65-ish is where most people get the symptom. It's how it comes out, ladies and gentlemen. It's the data. Going on to the next one, let's take a look at the good old sex versus age. Male and female. When I was digging through this information, I was really thinking I was going to find more males that had a situation or symptom from the COVID vaccine versus females, because I kept looking at a lot of male names. Scratching my head here, but it's the data. I got to trust it. More females than men. Although it is interesting, you know, the blue and yellow signifies the difference between male and female. So not the age thing on this one. What is interesting on this is between the age of 44 and 75, they're consistent, but that's, again, the spike, the spearhead, if you will. So that was pretty interesting to me. All right, done with the graphs. Now we're going to have some fun. And it's not really a lot of fun because some of the stuff is pretty disheartening. But like I said earlier before the show, I was out there digging through the stuff with my wonderful little hat on, Hartson.org. And I went through a lot of data, and I've been going through a lot of data. So let's dig in, take a look at our first case. And this is data straight out of the database. I'm not making this up. When somebody says, well, I think, or it seems like, or most people don't, I don't buy it. Show me the data, random data, and a lot of it. So I got almost 400,000 things to look at, and I looked into it. So I did this a couple different ways. So the first one, I apologize, cut off the ID of the person, so I can't go back and double look into it, but had the vaccine and then ended up with swelling of the hands followed by angioedema. Fancy name for your chest cavity area. Not lying. All right, here we go. 37-year-old female from Alaska. About 5 minutes after the vaccine, she developed a chest tightness. Chest tightness. What was the last one? What's this one? Increased work in breathing, palpitations, severe dizziness. She received oxygen, Benadryl. Benadryl seems to be something that people give a lot of. So you have the problem after getting a vaccination, make sure you got Benadryl on hand. Make sure it's okay with your doctor. I'm not a doctor. IV fluids, and 4 hours afterwards, she continued to take Benadryl, and she also developed red facial rash. There was also pain in the injection site beginning after the injection. Heart, cardio, pain, rash. Remember taking a look at Amber's rashes? There's a correlation there. All right, here we are. Our next victim here is 40-year-old female from Alaska. She received the Pfizer COVID-19 vaccine and had a severe allergic reaction to the influenza vaccine with egg preservatives in the past. She's received the flu vaccine without eggs and never had a problem. But they decided to watch her very closely. 40-year-old female, not presenting any symptoms, gets the vaccine. What happens? What do you think happens? Patient developed throat tightening approximately 20 minutes after the vaccination. She had to get an EpiPen injection. That doesn't sound good to me. 40-year-old female. Next one. Boom. We will go to this wonderful one right here, and we will look at our 27-year-old male from Kentucky. Vaccinated at 10 o'clock in the morning. No incident. Went to work, got nauseated, got dizzy, feeling like he was going to faint. They sent him off to the doctor. He was feeling better. Blood pressure through the roof. Here's another common theme, my friends. Blood pressure, 178 over 120. Heart rate, 140 beats per minute. If you don't know, that's not good. Next. Heart. Takes care of the heartbeats. It's like the heart is saying, I can't figure this stuff out. I don't know what you're putting into me, but it's not natural and it doesn't feel right. And so I'm going to have pain. I'm going to create pain. I'm going to create rashes. I'm going to create a real fast beat so that you know that something's not right. 24-year-old female shouldn't even be getting a vaccine, I don't think. My opinion. That's my opinion. 5 minutes after getting the vaccine, she had increased heart rate, shot up to 198 beats per minute. Ho, 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 ho. Wow. Normally it's in 50 beats per minute. Left pupil dilated completely. Right pupil constricted to pin size. Make sure we're on the same slide here. Extremities went numb and cold. Given Benadryl. Heart rate returned to normal. All of the other symptoms disappeared after treatment. So the treatment didn't work. So they had to treat with the treatment to treat the treatment. How's that one? Here we go. Not making this stuff up. Can't make this stuff up. Patient was monitored after the vaccination. The patient said her knees felt weak. And then she fainted. And she was on the floor when this person that entered the stuff arrived. She felt like she was floating and she didn't want to fall. She also felt nauseated, but she didn't throw up. Patient fainted several more times. Patient fainted several more times. Can we talk brain problems here? Why do we faint? Because we don't have blood pushing through our bodies where it needs to go. Where does the blood get pushed from? Our heart. See a common theme? I'm going to ask you that for the next 10 minutes. All right. Here we are. Patient had a vaccination, was cleared to go. Told his wife he was thirsty. Felt worse, wanted to go to the emergency room. Guess what? 79-year-old male, I get it, just had a vaccination. Is it a coincidence that he had gone into full arrest? Full arrest. Heart again. Blood. Our next one, Our friend here is 18 years old, male, and lives in Minnesota. Loves riding his bike. And no, I'm kidding. Fever, pain, headache following the injection. Achiness, chest pain, bilateral, forearm tingly pain. Now here's the thing. Went to the hospital room and got treated. Again, all this stuff. Chest, pain, tingle, pain, heart. This one bothers me a little bit. Don't take a nap after you get your vaccine. Day after this 47-year-old female from California got her injection, she was taking a nap, and her phone on her watch kept giving her signals, and she didn't check till 5:30 that afternoon because she felt like she wanted to take a nap. But when she woke up, she had heart palpitations. She was treated and told that she was having a temperature of 102, fluids, x-rays, released later that day. All right, so there we are. Some of the stuff I looked at. We're not done yet, though, because I wanted to take this just a little bit further and say to myself, well, maybe it's possible that I'm just not being random enough. So I also looked at the fact that we had a high number of young people who were showing up with symptoms after the vaccination. Theoretically, they would not have a symptom if they didn't get the vaccination, right? Unless they got COVID. But since we're going like this with getting COVID, it makes sense that we would go like this for taking the vaccination on our younger children, young adults. Going down, going down. But I decided, what the heck, let's take another look. So me and my handy dandy little hat from the Bryan Hartson show sat and read some more. Whole bunch more. I'm going to fly through this pretty quick, but I will tell you this. I decided to randomly look at youth. It means the younger ones. So this slice, I just looked at, sorted by age, and I just went boom, boom. I didn't look at it, what the outcomes were or anything. And you'll be startled. So, here we go. First one. 14-year-old male. It is a 14-year-old male. Myocarditis. Presented with chest pains, found to have some stuff going on. Pain was resolved. La 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 la. Here's the interesting thing. Patient had documented COVID in October 2020. Why is he getting the shot? Patient's brother had histories of problems after COVID vaccine. Why is this patient getting a vaccination? Maybe he's one of the doctors that stayed at that hospital that everybody else got fired in because they were smart and stood up for their rights. I don't know. Next patient is 14 years old, is a male. After administration of the vaccine, had a week-long episode of moodiness and irritability. My friends, listen to me on this one. This culminated in a suicide attempt by hanging in his bedroom that was interrupted by his father. So one might ask, maybe he has a history of trying to commit suicide, being depressed, having other issues. But lest there be no prior history of suicide attempts, no other clear identifiable triggers to this incident. Now, after 7 days, the patient returned to his previous baseline of mood. 14-year-old male. My son is 14 years old. My son. This could have been my son. That one gets me a little hot. Not in a good way. All right, 14-year-old male in Utah received COVID vaccine, got weakness on one side, had a stroke. 14-year-old male. Still in pediatrics ICU at the time of this writing. 14 years old. Stroke. Why do we get strokes? Goes back to the heart. Blood flow. This isn't rocket science. 99.9999 blah 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 percent of people that are in that age group of a younger age never die from it. Don't get these things going on. 16-year-old female from Arkansas. History of autoimmune disorder. So first of all, she's 16. She has the disorder of an autoimmune deficiency. Okay, I get it what you're going to say right now. She should get the shot because of the autoimmune problem. Or should she not? See, the question is, what are the effects of getting the vaccine? And how can I not get the COVID if I'm smart and I know that I have an autoimmune problem? Here's why. This is random, guys. She started losing her hair rapidly after about 6 to 7 days. Put on a large dose of prednisone, and after 2 weeks, it slowed down the alopecia. However, in the span of 4 days, she lost most of her hair. We, the doctors, are wondering if the vaccine could have exacerbated the autoimmune disorder. What kind of a question is that? Yeah. Sorry, that was my friend here. A little bit behind. There. You can read that real quick if you want. We'll pass on over to the next one. Since receiving his second dose of COVID, had a fever. Persisted for 3 days, woke up in the afternoon, taken to a hospital, transferred to another hospital. Cardiology was consulted, and there was some things that they think are happening around the heart. Again, 16-year-old male in California. "16-year-old male in Florida. No significant past medical history. Chest pains. Hard time breathing. Now he's still under care. Sounds like a heart thing to me. Not a doctor, but I see a pattern here. And this is random again, ladies and gentlemen. I didn't go look for these. I did not. Do your own research. You'll see I'm right. 16-year-old male, Maryland. Chest pain. Urgent care. Elevated levels. Same thing we've seen. Intermittent chest pains increased went off to another hospital. Don't know what ultimately happened. And finally, our 16-year-old female. Our 16-year-old female had excessive bleeding immediately following the needle withdrawal. Then 9 hours later, when the bandage was being removed, the patient fainted for 5 minutes. Wow. All random. Everything I did was random. It's all right here. It's all the data. You should see my floor. It's a disaster now. You get to decide. Should you take and get the vaccine or should you not? Should your children get the vaccine or should they not? If you're their parent, you get to make that life-changing decision. We know that if you don't get the vaccine, that if you get COVID and you are young, you are likely going to survive. The data shows that if you get the vaccine and you have a pre-existing condition, you may have a problem. Not to say you wouldn't have a problem the other way. If you are a young being and you get the vaccine and you have no pre-existing conditions, watch the heart, watch the blood, watch the rashes. There's enough smoke here that you should take it seriously. The heart, the blood pressure, the pulse, the blotchy skin. Again, the rashes. If you're a female, you got something to be a little bit concerned about when it comes to your menstrual cycles. I can't make a decision for you. I can make the decision for me. I can make the decision for my son as we discuss. And we will. Again. If we need to. And we'll look at the data again. At the time of this taping, things are really up in the air. And again, I can't say take it or don't take it, but what I can say is take the data to heart. And that's going to wrap up our show tonight. And I hope to see you at our next show. I do know tomorrow on the Bryan Hartson Show, we will be having a Dr. Edward Lee, who is a doctor of numerology. And there's some fun stuff we'll talk with him about. So please do set your DVRs and what have you for the show. I'm Bryan Hartson, and remember, today is the first day of the rest of your life. This is the moment that counts. Make it good. Good night.